Are you struggling with depression, anxiety, PTSD, or some other psychiatric issue? Are you feeling frustrated by not being able to find a treatment that's helpful, having tried a bunch of different medications and different type of therapies, and nothing seems to work? The field of psychiatry is rapidly evolving, and there's a groundbreaking therapy that's getting attention for its potential benefits. I'm talking about psilocybin, and specifically psilocybin-assisted psychotherapy. My name is Dr. sulmanazizmirzamd. I'm a psychiatrist who's board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine, and I've been a Spravato provider for some years now, and I've witnessed firsthand the transformative power of alternative treatments like esketamine for treatment-resistant depression. So join me on this trip as we explore psilocybin. See what I did there? Thanks for tuning in. If you're liking what you're seeing and want to get more of this type of content, make sure to like, comment, share, subscribe for more of the good stuff. Let me know if you want me to interview somebody about psilocybin, drop some names in the comments, and I'll try to make it happen. So what is psilocybin? Psilocybin is a naturally occurring psychedelic compound found in over 200 species of mushrooms, commonly referred to as magic mushrooms. When ingested, psilocybin is converted into psilocin, which binds to a specific serotonin receptors in the brain. This binding leads to the altered perception, mood, and consciousness that characterizes a psychedelic experience. The use of psilocybin-containing mushrooms dates back thousands of years in various cultures. In Mesoamerica, for example, indigenous peoples like the Aztecs and the Mazatec's used these mushrooms for religious and healing ceremonies. Ancient rock paintings in North Africa also suggest a long history of psilocybin use in traditional societies. More recently, the study of psychedelics, including psilocybin, gained momentum in the 1950s and the 60s. However, a wave of legal restrictions, such as the Controlled Substances Act of 1970, as well as negative public perception, halted most research by the early 1970s. Despite these restrictions, interest in psychedelics has remained steadfast, and a subculture grew until it could no longer be ignored. Fast forward to the 21st century, and we're now witnessing a renaissance in psychedelic research, with psilocybin emerging as a promising treatment for a variety of mental health conditions. A psilocybin psychedelic experience, often called a trip, can vary greatly from person to person and depends on factors such as the dosage, standard dosing versus microdosing, the set, or the individual's mindset, and the setting, or the actual physical and social environment where the trip is occurring. However, there are some common elements that many people experience during a psilocybin trip. Some of these can include visual alterations. Many users report seeing vivid colors, geometric patterns, and intricate fractals. Objects might appear to be moving, morphing, or breathing, and closed eyes visuals can be particularly intense. Emotional changes. Emotions can be heightened and fluctuate rapidly during a psilocybin experience. Some users report feelings of profound joy, love, and connectedness, while others may experience things like anxiety, fear, or sadness. Altered perception of time. Time may seem to slow down, speed up, or become completely irrelevant during a psilocybin trip. Moments can feel like they last forever, or the entire experience may seem to occur outside of time. Ego dissolution. Also known as ego death, this phenomenon is characterized by temporary loss of one's sense of self. The boundaries between the individual and their surroundings may blur, leading to a feeling of unity with the world or merging with the environment. Spiritual or mystical experiences. Some users report encounters with divine beings, deceased loved ones, or other entities. Others describe a sense of cosmic interconnectedness or profound realization of the nature of existence. Enhanced introspection. Psilocybin can facilitate deep introspection, allowing individuals to explore their thoughts, emotions, and their memories in new ways. This can lead to insights and personal growth that may have lasting effects even after the experience has ended. Synesthesia. A blending of the senses can occur during a psilocybin trip, such as seeing sounds or hearing colors. However, it's really important to remember that not all psilocybin experiences are positive. Some people may have a bad trip, which may involve intense negative emotions, frightening hallucinations, or feelings of paranoia. The likelihood of a negative experience can be minimized by ensuring that the proper set and setting and working with a trained guide or therapist when using psilocybin in a therapeutic context. The importance of a trained guide or therapist cannot be overstated. They can help create a supportive, safe, and comfortable atmosphere, which is crucial for a positive experience. These professionals can also assist with preparing you for the journey and integrating the insights gained during the trip into your everyday life. Recent studies have suggested that psilocybin has the potential to treat a range of psychiatric disorders. The compound's ability to rapidly and profoundly alter perception, mood, and thought patterns may provide unique therapeutic benefits, particularly for patients who have not responded to traditional treatment. I've included a link to some research findings on psilocybin in the description below, but let's quickly summarize some of the disorders and the research. When we're talking about major depressive disorder, a 2021 study showed that psilocybin was comparable to the antidepressant Lexapro, escitalopram, in its antidepressant effect, and that it appeared to be better tolerated. With anxiety disorders, a 2016 study demonstrated that psilocybin can help reduce anxiety, particularly in patients facing life-threatening cancer. The therapy has been shown to improve emotional well-being and quality of life. OCD, or obsessive compulsive disorder. A small 2006 study showed that psilocybin may have potential in treating OCD by reducing the severity of symptoms and the frequency of intrusive thoughts. And PTSD, post-traumatic stress disorder. While more research is needed, early findings indicate that psilocybin therapy may help individuals with PTSD by promoting emotional processing, fostering a sense of safety, and facilitating the reintegration of traumatic memories. Currently, another psychedelic, MDMA, is the leader for treatment of PTSD. I'll get around to making a video about that one day. And substance use. Psilocybin has shown promise in treating various forms of substance use. Some studies have shown that the therapy can help individuals quit smoking and reduce alcohol consumption, often with long-lasting effects. It's crucial to emphasize that these positive results seen in these studies were achieved in a controlled clinical setting with the guidance of trained professionals. This environment ensures patient safety and allows for proper dosage, preparation, and integration of the psychedelic experience. As with any psychiatric treatment, it's essential to work with a qualified healthcare provider when considering psilocybin therapy. As research into the therapeutic potential of psilocybin continues to grow, we can expect to see new applications for this compound in mental health care. Researchers are investigating its potential for treating a broader range of psychiatric disorders, as well as refining the therapeutic protocols and procedures to optimize patient outcomes. Psychedelic therapy, including psilocybin-assisted psychotherapy, represents a paradigm shift in modern psychiatry. By harnessing the power of these profound and transformative experiences, mental health professionals can help patients explore and address the root causes of their symptoms, leading to lasting improvements in their well-being. As we continue to learn more about the potential benefits and applications, it's essential to remain informed and open-minded about these alternative treatment options. Before we wrap up, I'd like to encourage you to like, share, and subscribe to my channel for more insightful content on psychiatric treatment options and the latest developments in mental health care. Your support helps us reach more people and spread awareness about alternative treatments like psilocybin therapy. Join the conversation by leaving a comment below, share your thoughts, experiences, or questions about psilocybin and other alternative treatments. Let's create a supportive community where we can learn from each other and work towards better mental health for all. Thanks for watching, and I'll see you in the next video.